using a, oh yes, the recording. Thank you, Shannon, for reminding us that we are going to be recording the first part of our conversation. So we're gonna divide our time together in two parts. Like I said, we're gonna first talk about all things policy, and we will record that part of the session. But when that is done, we will just stop the recording and keep our conversation a little bit more community-centered and focused. So we're going to go ahead and record. So for the folks that are going to be watching this at a later time, we're recording the policy section. And if you're interested to hear more about the organizing that we're going to be speaking, don't hesitate to contact me and to schedule a conversation. So that said, I am delighted and overjoyed to introduce our first speaker. Daniela Diaz is the Senior Federal Strategies Manager at All Above All, where she works with coalition partners and the Hill to advance the EACH Act and defend against the expansion of abortion coverage bans. So Daniela joined the All team with a scope of experiences that encompass a strong knowledge of the abortion care and provider community through her work with the Allentown Women's Center, the National Abortion Federation, and most recently as the Assistant Director of Public Policy with Physicians for Reproductive Health. Daniela is a We Testify abortion storyteller, and she graduated from Lafayette College, where she studied international affairs and earned a master's from the American University of Paris. So Daniela, thank you for being with us, and we're excited to learn about the EACH Act.
Hi, everyone. Thank you so much for taking some time to share with us and with me tonight. I have some slides, and I'm wondering if we can put them up. But I'll get us started. So this shifts my screen, so just give me 2 seconds to get my screens together. So I'm excited to get to tell you a little bit about the work of All Above All. And as we said, my name is Daniela and my pronouns are she, ella, and I'm the Senior Federal Strategies Manager with All Above All. So today we're going to chat a little bit about the origins of the first abortion insurance coverage ban, which is called the Hyde Amendment. And then we're going to talk about the EACH Act, which is a proactive bill that we created that pushes back on the Hyde Amendment. And lastly, we're going to close out with our new body of work, which is the Action Plan for Abortion Justice. So I'm going to take you all on a little bit of a ride through history and a ride through thinking about abortion justice together in the future. So to tell you a little bit about All Above All on the next slide, we are a catalyst for abortion justice. Our work centers people of color working to make ends meet, and we mobilize at the intersection of economic, immigrant, and racial justice. And we'll see a little bit more about what that means once we get to the abortion justice body of the work. All Above All is a network of over 150 organizations that are state, federal, abortion funds, clinics, and other cross-movement organizations, of which Catholics for Choice is one. So for those of you who are wondering about the term abortion justice, the reason why we landed on that terminology is because it reflects the abortion-specific nature of our work and our justice-based intersectional approach to the work that incorporates an understanding of how systemic racism, economic insecurity, and immigration status, in essence, expand and multiply the barriers for someone seeking abortion and abortion care. So in the next slide, we're going way back to 1976 to the beginnings of the Hyde Amendment. And on this next slide, and hopefully the image will show up in full, is basically a quote used by Representative Henry Hyde, a Republican from Illinois, who brought about the Hyde Amendment to existence. So in essence, he says, I would certainly like to prevent, if I could legally, anybody from having an abortion, a rich woman, a middle-class woman, or a poor-class woman. Unfortunately, the only vehicle available is the Medicaid bill. So from here, we can see that the goal of what the Hyde Amendment is. It is, in essence, to block insurance coverage of abortion with a type of insurance, and that insurance is Medicaid. So that was the original ban put in place in 1976. And since then, the ban has grown over time. But let's talk a little bit about this ban so that we have a real understanding of what's going on. So since it was enacted in 1976, Congress has included it in every iteration of the bills that government uses to set its budget. This is called appropriations. And since then, we have seen not only it be included in the bill that impacts Medicaid, which is the Labor H bill. And the Labor H bill, just to explain a little bit, impacts the Medicaid program, the Medicare program, and the CHIP program, right? So what has happened since is that they have expanded the location of that same abortion coverage ban to include and tackle a much larger population. So just to be, fully transparent and clear, the reason why we place such a strong focus on the Labor H bill is because, one, that's where the original abortion coverage ban lives. And that's also where we see the largest chunk of population being affected by the ban through the Medicaid bill. Also, to contextualize the moment, since last year, where we saw the Dobbs decision and what in essence we call the fall of Roe, states have been racing to ban abortion across the board, adding on layers upon layers of obstacles for access. So when lawmakers restrict abortion care, they take away people's ability to control their lives, their bodies, their futures, and to live with dignity. And we already know that our healthcare system already fails Black, Indigenous, and other people of color. So barriers to abortion care ultimately just make that worse. And to reiterate, which I think is really important to highlight, the intention of Hyde in his amendment and in the quote that I mentioned, sees an impact that is worsened by systemic racism, that is worsened by economic insecurity, that is worsened by immigration status, and has incredibly far-reaching consequences for people working to make ends meet. So in the next slide, we're going to see the full roster of population that are impacted by the Hyde Amendment. So the Hyde Amendment impacts insurance plans that are funded with federal funds. And the list of insurance plans, not the plans, but like the populations impacted, are on the slide. So I'll go over them briefly because it's a long roster. We have folks who are on Medicaid, on Medicare, and the Children's Health Insurance Program. The Hyde Amendment impacts federal employees and their dependents. And the federal employee program is massive, right? We have millions of federal employees. This impacts the Peace Corps volunteers, Native Americans through the Indian Health Services. This impacts people in federal prisons and detention centers, including those detained by immigration authorities. This impacts military service women, veterans, and their dependents via TRICARE. And it also impacts low-income women in the District of Columbia. So what did we do about the Hyde Amendment? On the next slide, we get to share a little bit about the EACH Act. So we collectively created the EACH Act about 10 years ago, and the EACH Act had a different name at the time. The EACH Act, in essence, stands for Equal Access to Abortion Coverage in Health Insurance. And what the bill does, as I mentioned earlier, is it works to reverse the Hyde Amendment and related abortion
All
coverage
right,
restrictions.
potatoes in the oven, or are you going to do those?
All right. And so it in essence works to reverse the Hyde Amendment and related abortion coverage restrictions. When I say related abortion coverage restrictions, it's all of the other folks that I mentioned in the previous slide that are impacted beyond the Medicaid program itself, right? And so this year we saw the introduction of the bill that it took place in January 26th in the House of Representatives under the leadership of Barbara Lee, Ayanna Pressley, Diana DeGette, and Jan Schakowsky, and we are currently working on a introduction in the Senate this spring. In the Senate, the bill is led by Senator Duckworth, Hirono, and Murray. And so congressional periods happen every 2 years. We just started a new congressional period. So we've introduced the bill twice in both chambers. But in the House, the bill saw its 5th introduction this year. And in the next slide, we can see a little bit about what the EACH Act does in true technical terms, right? So EACH Act creates 2 important standards for abortion coverage. First, the EACH Act respects that each of us should be able to make our own decisions about pregnancy, and it ensures that every person who receives care or insurance through the federal government will have coverage for abortion services. And second, the EACH Act prohibits political interference with decisions of private health insurance companies to offer coverage for abortion care. So in essence, the EACH Act gets us one step closer to abortion justice, and it guarantees coverage of abortion without restrictions based on how much money we earn, how we're insured, or where we live. And over the past 10 years, support for this bill has grown exponentially. And that is thanks to the work of folks like you all who are learning about the bill today, who are willing to call their Congress members and have conversations about the importance of bold, proactive legislation to help us get to a better place, but also help us manage the fact that we're in a completely changed landscape as a result of last year's Supreme Court decision. And on the next slide, we can talk a little bit about where we're going with all of this, right? Our goal is to get to a place of abortion justice. And I'm going to share a link with you all in the chat that reviews the action plan. I know that everyone has different learning methods, and I know I love reading something and getting able to see some text. So I'm sharing that with you all. So what's happening now? What I've shared on the slide is the framework of the action plan for abortion justice, and we're working on creating proactive legislation at the local, state, and federal level. At this point, we have already created our local resolution, and it's been the first city that adopted it was Dallas, which was incredibly exciting to find that this local resolution was adopted in the state of Texas, the state that saw a total abortion ban and has been in that scenario since September of 2021. And so we are very excited to be able to, work under this framework to gradually get us to this plan for abortion justice. And what exactly is that? And this is me tying it back to the beginning of the conversation. It consists again of bold proactive policy that aims to allow for abortion to be available without hurdles or stigma for people of color working to make ends meet, young people, LGBTQAI people, and gender nonconforming people. It also aims for abortion to be available, affordable, and accessible for immigrants regardless of documentation status, without fear of deportation, detention, or harm to their or their families, to their own or their family's immigration process. We're also hoping to inculcate into this body of work that abortion be available in communities where we live. It is incredibly hard, to find an abortion clinic unless you're in a very urban setting. And some states, as you all know, have one clinic. And And then we wanted to include, something that is directly tied to medication abortion and telehealth, that it's provided in ways that are comfortable, secure, and make sense for the patients. And lastly, a piece that is incredibly important that we've carried through our work over the years is that abortion care is affordable and covered by all public and private health insurance plans. And so that's a little bit of the story of the Hyde Amendment that started in the 1970s, how we got to the EACH Act, and what we're working towards moving forward. So I'm really grateful for being able to present to you all. And if you have any questions, you just let me know. But I'll pass the mic over to Steph.
Thank you, Daniela, so much for this amazing overview of the EACH Act. Like I mentioned, if you were part of our lobby day, this was one of the bills that we were asking our elected officials to sponsor and support. So we're so grateful for you putting it in such simple terms. I definitely appreciated knowing the history and learning even more about the EACH Act. So thank you, Daniela. And now, also another piece of legislation that we were working on during our lobby days is the Women's Health Protection Act. So this piece of legislation is also a priority at CFC. So to talk about the Women's Health Protection Act, or WIPA, like we call the acronym, we're joined by my amazing colleague, Molly, our federal policy associate. Molly recently graduated from law school and has previously worked at the National Abortion Federation, the Center for Reproductive Rights, and as a clinic escort at Planned Parenthood. Molly is enthusiastic about a future where all people everywhere can access abortion on demand and without stigma. So I'm so excited for Molly to talk to us about WIPA and for you all to welcome Molly to this webinar, but also to CFC. Thank you, Molly.
Thank you. So like Steph said, my name is Molly. Quick image description. I'm a white woman with brown curly hair in front of a plain white wall, and I'm going to be talking about Women's Health Protection Act. The Women's Health Protection Act would protect the right to abortion by instituting a nationwide safeguard against bans and restrictions. So we know that abortion is safe, essential healthcare, and that access to abortion services is a basic human right. However, reproductive health care is often singled out for regulation that doesn't apply to any similar medical services. So this legislation would change that. And I want to start off by saying we know the bill is called the Women's Health Protection Act, but people of all genders can and do get pregnant and may need to access abortion care in their lifetime. With Roe overturned, over 17 million women of reproductive age, plus trans men and non-binary people who can get pregnant, no longer have access to abortion unless they travel to another state or self-manage their abortion. And I just wanted to make sure that we weren't excluding anybody from this important conversation. So the people hurt most by abortion restrictions are those who already face discriminatory barriers to accessing healthcare, including people of color, women, those working to make ends meet, members of the LGBTQIA+ community, immigrants, young people, those living in rural communities, and people with disabilities. Data also shows that states with the most restrictive abortion laws also have the weakest parental support, and that includes things like access to healthcare and financial assistance. Also, states with the most restrictive abortion laws are associated with higher maternal mortality rates, and in most states, that's particularly true for Black women. And as people of faith, we're called to advocate for policies that advance the human rights of those who are most marginalized in our society and who are most harmed by abortion restrictions. And that's why Catholics for Choice is such a fervent supporter of the Women's Health Protection Act. So some upsetting statistics for you. In 2022 alone, there were 839 abortion bans and restrictions introduced into legislation, with 66 of those enacted. And those abortion bans and restrictions led to abortion being entirely banned in 12 states, with near total bans in an additional 4 states, and 66 abortion providers were forced to close. So I'm going to run down a list of types of abortion bans and restrictions. There's gestational bans, method bans, reason bans, criminalization of self-managed abortion, targeted regulation of abortion providers known as trap laws, parental involvement laws, biased counseling requirements, mandatory waiting periods, mandatory ultrasounds, medication abortion bans and restrictions, religious refusals, personhood measures, and like Daniela just taught us about, domestic and global funding bans and restrictions. So I'm going to expand on a few of those that WIPA would specifically help combat, but if you wanted more information on them, they're all listed out on pages 98 to 102 of the Advocates Bible. So a gestational ban is a policy that outlaws abortion care based on the gestational age of the fetus. A reason ban is a ban on abortion care supposedly sought based on things like fetal sex, race, or genetic anomaly. Mandatory ultrasounds are policies that require abortion providers to give patients information on accessing ultrasound services or to perform an ultrasound on each person seeking an abortion. Some states require providers show and describe the image to the patient, while others mandate that patients be offered the opportunity to view it. Trap laws are medically unnecessary requirements designed to shut down abortion clinics, thereby making it more difficult for people to access care. And these restrictions can include things like hallway measurements or clinic lighting. Sometimes they even require abortions to be performed in a hospital after a certain gestational age, which just isn't necessary. Parental involvement laws require that one or both parents of a minor patient are either notified or provide express consent before a minor can access their abortion care. Biased counseling requirements are policies that force providers to share misleading and inaccurate information with patients before an abortion under the guise of obtaining informed consent. Examples of that include incorrect claims that abortion causes breast cancer or unfounded claims about fetal pain. Mandatory waiting periods are policies that mandate patients wait a specified time period between initial counseling and having an abortion, and multiple visit laws require that a patient make one or more medically unnecessary in-person visit to the abortion provider in order to obtain their abortion services. So with that brief overview, it's clear that the so-called pro-life movement has been very creative in ways in which they've made medically unnecessary abortion restrictions. These restrictions only serve to decrease, sometimes delay abortion care, and in no circumstances provide any sincere help to the pregnant person seeking that abortion care. So WIPA protects a patient's right to access abortion free from medically unnecessary restrictions and bans on abortion, including those that I just mentioned. It does this by creating a statutory right for healthcare providers to provide abortion care and a corresponding right for their patients to receive that care, free from the medically unnecessary restrictions that target abortion and abortion access. So where we are now is the Women's Health Protection Act is supposed to be reintroduced into the House and Senate later this month. During the last congressional session, the 117th, the House of Representatives demonstrated moral leadership by passing WIPA twice, but unfortunately their Senate colleagues failed to do so because of the racist and outdated filibuster. So a little bit about the filibuster. Senate filibuster rules require that most legislation, including any related to abortion rights, have support from at least 60 senators to move forward. Unfortunately, only 49 senators voted in favor of passing WIPA. Those most affected by the filibuster are Black people, LGBTQ+ individuals, women, Indigenous people, and immigrants, because most of the legislation that is being stalled by the filibuster in the Senate aims to provide protection and support to marginalized communities across the United States. So we're hopeful that during this congressional session, WIPA will pass in both the House and the Senate. During our week of action in January, which many of you attended, Catholics for Choice and our advocates met with 39 members of Congress from 25 states, and we shared with them the importance of passing WIPA. The majority of the offices we spoke with were intending to co-sponsor or at least vote in favor of the Women's Health Protection Act. And if WIPA passes in both the House and the Senate, we'll finally have that federal legislation that will safeguard the essential human right of abortion. That's all I have, and I will pass back to Steph. Thank you.
Thank you, Molly, for explaining to us, and especially going into such detail about the specificity of these bans. I think it's so helpful for us to be educated and to know that. So thank you so much, Molly. So we covered two pieces of legislation, and now I'm excited to turn our attention to a constitutional amendment. And for that, we have our amazing policy director at Catholics for Choice, Shannon Russell, who is going to tell us all things and update us about the ERA. Thank you, Shannon.
Thank you, Steph. Oh, it's so wonderful to be with all of you tonight. Quick image description of myself. I'm a white woman with long brown hair, wearing a purple shirt and some flashy earrings. So equality of rights under the law shall not be denied or abridged by the United States or by any state on account of sex. This simple sentence, literally only a couple of words, represents the single most important step that the United States can take to safeguard the rights of women and LGBTQIA+ people, finally ratifying the Equal Rights Amendment, or the ERA. Many Americans believe that women and gender-expansive people are already guaranteed equal rights under our Constitution. And what's more, opponents of the ERA want you to believe that it's dead and gone. Both of these notions are false. In fact, this transformative amendment is so alive that just this week, the Senate Judiciary Committee held a hearing on it. Senate leaders, including pro-choice Catholic Committee Chair Durbin, argued that the ERA has been properly ratified and should be our 28th amendment today. You probably know this history, but the ERA was first introduced in 1923 and subsequently reintroduced in every single session of Congress before passing both the House and the Senate in 1972, at which point this arbitrary deadline was placed on the ratification process. No other constitutional amendment has ever been levied with such a deadline, and thanks to the relentless campaigning of Phyllis Schlafly, right-wing religious groups, and plenty of Republican men, the ERA was not ratified by its deadline. And even now, having met all the constitutional requirements for ratification, what should be our 28th amendment remains out of reach due to procedural hurdles that are being used to deny us the constitutional equality that we deserve. At the same time, based on everything that Molly and Daniela have both said, we know that the need to permanently remove the fate of fundamental rights like access to abortion and gender-affirming healthcare from the province of partisan politicians and capricious courts has never been greater. If published, the ERA would provide a constitutional basis for challenging all of these state abortion bans and restrictions that Molly walked us through as a form of sex discrimination. And state level ERAs are already proving that this is true. One powerful example is the Connecticut ERA. A state court determined that it's, quote, clear under the Connecticut ERA that a regulation accepting medically necessary abortions from the Medicaid program discriminated against women and indeed poor women. So this is like the Hyde Amendment, but in Connecticut. And the court said that it discriminated against women under their state's ERA. New Mexico's state Supreme Court later cited this opinion when relying on the state's ERA to find that their state Medicaid program discriminated against women. In holding that the program had to fund medically necessary abortions, the quote noted that, quote, since time immemorial, women's biology and ability to bear children have been used against them as a basis for discrimination. The demonstrated protection that's provided by the ERA really strikes fear in the hearts of the Catholic hierarchy, so much so that the National Right to Life Committee, which is the organization that sprung from the U.S. Conference of Catholic Bishops, or the USCCB, has a lobbyist dedicated solely to opposing the amendment. They recognize the ERA as powerful as, quote, a legal weapon to invalidate virtually all state and federal limits on abortion. And they refer to efforts to eliminate the ratification deadline as pure political theater and temporal absurdity. Additionally, the USCCB's Secretariat on Pro-Life Activities has published a memo deriding the ERA and noting that it is needed to ensure abortion access and knock down so-called pro-life laws. The bishops doubled down on this message just this week by publishing a letter to senators expressing their, quote, alarm with a number of far-reaching consequences that will arise from the ERA and its negative impacts to the common good and religious freedom. So despite what the USCCB would want our legislators and the general public to believe, we know that the majority of Catholics support access to the full range of reproductive health care. There has never been a more urgent moment to enshrine equality for people of all genders into the Constitution. And we agree with opponents of equality on only one thing, that the ERA will be used to protect abortion access. We see this as vitally important and part of the reason why we're urging Congress to finalize the amendment as soon as possible. So on January 31st, Rep. Ayanna Pressley, who's also one of the leaders of the EACH Act, and Senator Ben Cardin introduced a joint resolution, that's HJ Res 25 and SJ Res 4, to affirm the ratification of the ERA, removing the deadline and recognizing the amendment as part of the Constitution. Congresswoman Pressley noted that the resolution, quote, will help address centuries of gender disparities in America by removing unnecessary barriers that have prevented us from enshrining the dignity, humanity, and equality of all people into our Constitution. We agree with the Congresswoman and with Senator Cardin that there should be no time limit on equality. We encourage Congress to pass these resolutions as soon as possible. It's the right thing to do and long overdue. Thank you so much for listening to me about the ERA, and I'll pass it back over to Steph. But first, I'm going to stop the recording.